External cardiac pacing is non-invasive and causes minimal discomfort. If time permits, clean and dry the patient's skin. Shave or clip any hair to ensure good contact between the pacing electrode pads and the skin. Attach standard ECG monitoring electrodes to the patient and connect to the pacemaker device in monitor mode and verify that you have a clear, large ECG complex. Switch leads if necessary to obtain a better signal. For most patients, placing both pads on the front of the chest is more comfortable and easier for staff to monitor. Place the anterior pad just to the right of the sternum, below the clavicle, at the second or third intercostal space. Place the lateral pad below the left nipple just medial to the anterior axillary line at the fifth or sixth intercostal space. In patients with a large chest cavity or overlying breast tissue, the anterior-posterior placement may be more useful. Place the anterior pad just to the left of the sternum in the fourth or fifth intercostal space below the nipple. Place the posterior pad on the back to the left of the spine, below the left scapula. In this position, the heart is sandwiched between the anterior and posterior pads. Attach the cables from the pads to the pacemaker machine. If the patient's hemodynamically stable, consider giving IV sedation and analgesia. Set the output current. Typically, you should begin at the lowest level and gradually increase to determine the capture threshold. However, if the patient is severely symptomatic, start at the maximum output and slowly decrease. Set the desired heart rate on the pacemaker, typically 70 per minute, although for severely symptomatic patients, consider starting at 100 per minute. Turn the machine to pacing mode. Increase the output until electrical capture is achieved. This is termed the capture threshold. Electrical capture is demonstrated by a wide QRS rhythm following each pacer spike. You'll typically also see the patient's chest muscles contract rhythmically with the pacing impulse. Set the final output at 10 to 20% above the capture threshold to ensure an adequate safety margin. Check the femoral pulse to ensure adequate blood pressure. If the pulse is not obtained, increase the output. If a pulse is present but blood pressure is low or the patient is symptomatic, increase the heart rate. Adjust the heart rate to the lowest rate that provides adequate blood pressure and symptom relief. This is usually between 60 to 80 per minute. Secure the pacer pads with tape and ensure that there's enough slack in the wires leading from the pacer pads to the pacer.